Michael, and today I would like to present about COPD. So what is COPD? COPD stands for Chronic Obstructive Pulmonary Disease. Based on my research on Wikipedia, chronic obstructive pulmonary disease is a type of obstructive lung disease characterized by long-term breathing problems and poor airflow. The main symptoms is the shortness of breath and coughing with sputum production. COPD is a progressive disease, which means it worsens over time. Other than that, COPD, also known as emphysema and chronic bronchitis in its older day. Those with such a cough are at greater risk of developing COPD. On the right hand side is a photo of growth pathology of a lung showing central blur emphysema characteristic of smoking. This close-up of the fixed cut lung surface shows multiple cavities filled with heavy black carbon deposit. As you can see, the black spot is the black carbon. As of 2015, COPD affected about 174.5 million people, 2.4% of the global population. It typically occurs in people over the age of 40. Males and females are affected equally commonly. In 2015, it caused 3.2 million deaths, more than 90% in the developing world, up from 2.4 million deaths in 1990. The number of deaths is projected to increase further because of higher smoking rates in the developing world and an aging population in many countries. So this is the global statistic of COPD cases in the world. As for Malaysia, it is colored yellow, and it means that cases of COPD in Malaysia is in a moderate fashion. 9 million cases have been recorded for adults with diagnosed chronic bronchitis in the past year. And this amount of cases shows that we must be concerned about COPD. We must know a lot about COPD so that we can prevent it from developing in our body.
I'm going to talk about the effect of COPD on breathing. This diagram represents the lungs inside the body that presents the left lung and the right lung. As you can see here, the little tubes that comes from the top represents the sensual of trachea. That's what we breathe through. It goes into the bronchiole and gets into the lungs. As you can see, the purpleness represents significant inflammation that happens with pressure with COPD. That's the inflammation which produces difficult to breathe in, which happens cough. And then inside the purple area represents the mucus. Mucus that in sensual gonna be translated into this production that happens with COPD. Let's go deeper to learn about the alveoli. Alveoli is where gas exchanges happens, that where the air goes in and gets mixed with the blood so you can breathe. The redness area represents the damaging happens, which make less oxygen reach to the blood. That's why it is difficult to breathe. Next, I would like to show how COPD slowly damages the lungs and affects how you breathe to make you understand more.
My name is DEEPAK Kumar, and today I'll be talking about factors of COPD. The first and foremost is smoking. As we all know, smoking is very common in this century. Some of us may even think it's fashionable. So, according to my research, about 85 to 90% of COPD cases are caused by smoking. When a cigarette burns, we can find more than 7,000 chemicals will be mixed together. The toxins in cigarette smoke weakens our lung defenses against infection. It also narrows our passages and causes swelling in air tubes and destroy our air sacs. Secondly, exposure to air pollution. What we're breathing every day at work, home or outside may play a major role in developing COPD. Long-term exposure to air pollution, secondhand smoke and dust, fumes and chemicals can cause COPD. What is secondhand smoke? Secondhand smokes are smoke that are being produced by tobacco products, such as cigarettes and pipes. It also means smoke that has been breathed in and breathed out by others. Thirdly, a history of childhood respiratory infection. Newborns are more sensitive to infection. It is mainly because of their immature and inexperienced immune systems. The most common dangerous condition in newborns are lower respiratory tract infection that are mainly caused by viruses. So when a child grows up without curing it, it may cause a larger impact to that person. Last but not least, a genetic condition called alpha-1 deficiency. Alpha-1 antitrypsin deficiency is an inherited condition that increases the risk of lung and liver disease. Alpha-1 antitrypsin is a protein made by the liver whose function is to protect the lungs. If these proteins are malformed, the impact is predisposition for obstructive pulmonary disease and liver disease. Next, I'll be talking about diagnosing COPD. Normally, diagnosis is based on symptoms, a physical exam, and a diagnostic exam result made by the doctor. Firstly, you should list down your symptoms to your doctor. You're a smoker or has smoked in the past. You're exposed to lung irritation on the job. You're exposed to a lot of secondhand smoke. You have a family history of COPD. You have asthma or other respiratory condition. And finally, you take over-the-counter or prescription medication. These are few examples that I could come up with. After that, you should do a physical exam. Firstly, imaging tests include a chest X-ray or CT scan. This image can provide a detailed look at your lungs, blood vessels and heart. Second, an arterial blood gas test involves a blood sample from an artery to measure your blood oxygen, carbon dioxide and other important levels. Finally, spirometry is a test to assess your lungs function. During the test, you take a deep breath then blow into a tube connected to a spirometer. What is spirometry? Spirometry is a standard test doctors use to measure how well your lungs are functioning. The test works by measuring airflow into and out of your lungs.
My name is Krisha, so today I'm gonna talk about the treatment for COPD. I have do a lot of research and I get a new video. A doctor named Carla Lam, so she is a interventional pulmonologist. She have a new treatment for COPD. So let's watch it. I will explain it via that video. So the doctor treats COPD patients via FDA-approved device. It's a tiny, a few millimeters in size. It has no oxygen or surgeries. So the doctor will identify the most damaged lobe in a patient's lung and place it on completely to block the air leading. Like that. So the video explains that COPD patients can take the treatment because it is a good treatment and it provides a good oxygen exchanges and also the improvement on coughing.
My name is Muhammad Aziz bin Karunizal. Me and my group are gonna to present our model KMR. So guys, these are the materials for the model. So the first material that we use are one empty 1.5 liter bottle. At the bottle we make two holes. The first hole is at on the bottle cap, and the second one is at the bottom of the bottle. So the second material that we use is unused pen, a tissue paper, some rubber band, and a cigarette. So guys, I have done an initial recording of this KMR model process. So please all enjoy this video, okay? So guys, this carbon is the one which being spotted on the gross pathology lung of smoker. This carbon hardens lungs and make it less moist. Eventually, it will cause difficulties in breathing and death.